Hello, good afternoon, everyone. We are back for another Ask WHO Social Media Live Q&A. Today, you are here with me. My name is Yanowit Desh Panyawat, and I work in the Department of Communications at the World Health Organization headquarters here in Geneva. So, as we are ahead of World Tuberculosis Day or World TB Day tomorrow on the 24th of March, during today's live, we are going to talk about tuberculosis, which is one of the world's top infectious disease killers. And also, we would like to take this opportunity to help our followers understand better the health, social, and economic impact tuberculosis has on people around the world. And you will learn as we go along why we need to end tuberculosis once and for all. But now let me introduce you to our special guest today. I'm very pleased and honored to welcome Dr. Teresa Kaseva, WHO Director of Global Tuberculosis Program, who will be answering all of your questions today. Good afternoon, Dr. Kaseva. Thank you very much for being with us today.
Good afternoon and good morning, good evening to all our friends and colleagues who are joining today our live stream. And thank you for your attention and prioritization in your agendas today, TB, tuberculosis.
Thank you very much. And before I get back to you, let me also welcome our viewers who are joining us from all around the world. If you have any questions about tuberculosis, for those watching on Twitter, you can ask your question using hashtag AskWHO in your tweet. And for viewers on Facebook and LinkedIn, you can simply leave your question in the comment sections. All right, while we wait for the questions to come in, Dr. Kaseva, could you please tell us about the theme of this year's World Tuberculosis Day and why is it important to every one of us?
This year, the theme of the World Tuberculosis Day is the clock is ticking. And what it means that we are running out of time to reach our ambitious targets to end TB by 2030 to save millions of lives from this preventable and curable disease. While we are in the midst of the unprecedented pandemic of COVID-19, we should not neglect so-called all disease silent epidemic, which tackle people and causes enormous burden and hardships for all people, for many people around the world. Tuberculosis, as I told, is disease which exists for the centuries, it's preventable and curable, and that's why we need urgent actions to avoid unnecessary preventable death and suffering. And if you will ask, is it right time? Of course, it's time, because all lives matters, and there should not be a difference between people. We should address needs of the most vulnerable and poorest people. And you know that TB is disease of poverty. And without any delays, without any excuses, we should address these needs.
Well, thank you very much, Dr. Kaseva. That's a great introduction on this very important topic. And I just wanted to tap in very quickly on what Dr. Tedros, our Director General, said yesterday during the COVID-19 press conference. He mentioned the latest tuberculosis data showing that there were significantly fewer people receiving care for tuberculosis in 2020, and there are too many people who do not have access to TB services and often go undiagnosed. Could you please give us an update on the number, or perhaps elaborate on that? What are the implications of the situations?
Indeed, as I told, TB is one of the biggest infectious disease killers in the world. 1.4 million people died from TB last year, and unfortunately, due to COVID situation, we can predict additional deaths, up to 500,000 more deaths. And it's extremely concerning and a very bad tendency. Every year, around 10 million people fall ill with TB, and about 2.9 million people, according to our the last report, 2019 report, around 2.9 million people were missing. Missing because of different reasons. Either they were not reported, or they were not. They didn't reach services for diagnosis and treatment. But now, according to our monthly monitoring of the situation, we can see the sharp drops in TB notification. Additional 1.4 million people were not found, and now this gap, this group of so-called missing people is expanding. It's up to 4.1 million worldwide. And you can compare, if out of 10 million people, 4.1 million are already missing. And if we will not stop this tendency, it will mean that these people without diagnosis and treatment will face severe hardships, especially when, in addition to TB, they will meet another agent, COVID-19. And also, we know that TB could be transmitted, especially in the house, among household contacts. Another important information should be known that about a quarter of the world's population is infected. What it means that though they have no disease, but they have definitely more risks for the development of this disease. And during socio-economic crises, as we're facing today, this vulnerability, number of people who have potential risks for the development disease from being infected is growing. And this is also important to know. In terms of who is affected more, we must say that around 56% of people affected annually are men, 32% are women, and 12% are children. But as I told, TB is a preventable and curable disease. The vast majority of people could be treated. So these are the main numbers, the main tendencies, and we should be aware about these risks, and we should not ignore.
Well, thank you very much for a very clear explanation on the number and data on tuberculosis worldwide. So also let me remind you, our viewers, one more time, our focus today is on tuberculosis, whether it be prevention, screening and treatment. Any questions related to this topic are most welcome. To ask your question on Twitter, use hashtag AskWHO in your tweet. And those of you who are watching us from Facebook and LinkedIn, simply leave your question in the comment section. We will take your questions very shortly. All right. Before we dive into more details on what has been done and what is needed to be done to end tuberculosis, let's do a TB 101 question. Shall we, Dr. Kaseva? Perhaps you could explain to our viewers what are the cause and symptoms of tuberculosis, and how can people prevent themselves from infection, especially during COVID-19?
A very important basic question, and this basic knowledge and awareness should be everywhere, because TB, we can meet TB unfortunately everywhere. Tuberculosis is a communicable disease caused by Bacillus Mycobacterium tuberculosis, and this bacillus is spread when people who are sick and not on treatment expel into air, for example, by coughing mycobacteria. TB primarily affects and typically affects the lungs, but also can affect other sites like bones, lymph nodes. Of course, we can imagine that it can affect anyone, but still there are some special risk groups, the vulnerable groups, and these groups are also well known. We know so-called social determinants of the disease. TB is affecting, unfortunately, the poorest, the most vulnerable populations, and with such conditions as undernutrition. People living with HIV are also among the most vulnerable. With the diabetes, using alcohol, with tobacco smoking, And all these conditions can increase the risk of the development of the disease. But of course, this infection could be prevented. And first of all, what should be done? Early diagnosis, testing, and treatment is essential measures, and of course, they're curtailing on what transmission of the infection. Another measure, and these measures are also well known, regular screening and provision of the TB preventive treatment in case you have TB infection. Another important measure, of course, as we know, social determinants, we can address these determinants. And for example, social support measures for the poorest people, for the people with undernutrition, with diabetes could help. And of course, it's well known that the best way to prevent diseases, the best opportunity is vaccination. We have BCG vaccine, well known. We are celebrating this year 100th anniversary of this vaccine, and though it can prevent from the development of the severe disease, especially in young children, but it's not anymore the vaccine of our dream, and which can prevent and massively protect many people, especially adults. So that's why we are looking now at the situation with the COVID and how fast, with the joint efforts, with the support of the high-level officials and different stakeholders, we can receive new effective vaccines. And just for 1 year, we have already several vaccines against COVID, but we're still using, in comparison, 100-years-old vaccine for TB. It's the matter of prioritization and political will, for sure.
Well, thank you very much for a very detailed explanation. All right, we now have questions started coming in from our live audiences, and thank you very much for sending those people. All right, seeing the first question here, a viewer from Facebook asks, should all health workers get vaccinated against TB?
Important questions. Of course, health workers, community health workers are facing first with the patients when they are screening, where they're tracing contacts and providing services to them. And of course, all infectious control measures should be in place for them, for our health workers, and they're now also at the first front. But as I told, BCG vaccination is not, unfortunately, effective for adults. We can prevent primarily children, young children, with BCG vaccination. But for the prevention of the disease in adults, we need new and more effective vaccine.
All right, thank you. And here's another follow-up question, which is very interesting from what you have just explained to our follower just now. Pej Chan Rasmi on watching us on Facebook asking, can TB patients get COVID-19 vaccination?
Yes, my response will be yes. There are no known restrictions for the patients with TB to be vaccinated against COVID. And furthermore, I must say that for sure, there are more significant risks of the development of severe COVID for the patients with TB, because both diseases are affecting, as I told, primarily lungs. And of course, with the two lung illnesses, it will be much more difficult to expect the good treatment outcomes. So that's why we are encouraging member states, especially in the high TB burden countries, to prioritize patients with TB for the COVID vaccination.
Great, thank you. And so here's quite a few questions coming in now. So I have here a question from viewer on LinkedIn. He or she asked, can COVID-19 worsen the conditions of people living with tuberculosis?
And again, my response will be most likely yes. Because of the same reasons, while we are looking for the data, we are trying to collect evidence from the studies, and I'm sure we will be able to present the results of the analysis and strong recommendations. But as we can see now, people with the comorbidities are facing much more challenges in terms of the severity, as I told, of the disease, and also other social determinants. Frequently, people with the TB have also other comorbidities, as I told, HIV, diabetes, and all these conditions are worsening the situation for these people.
All right, thank you very much, Dr. Kaseva. Just a reminder for all of you who just joined us, our program today is on tuberculosis, ahead of World Tuberculosis Day tomorrow on the 24th of March. We have here with us Dr. Teresa Kaseva, WHO Director of Global Tuberculosis Program. You can send over your questions to our expert using hashtag AskWHO on Twitter, or leave your question in the comment section on your Facebook or LinkedIn. And so just go back just a little bit when you explained to us as tuberculosis is not a new disease, and you said that it's been with us for a very long time, and we have these treatments, medications, and vaccines. But Dr. Kaseva, the number of deaths from tuberculosis is still daunting, with nearly 4,000 people dying from TB every day as we speak. Despite that, why is this still the case? What is holding us back from ending tuberculosis?
Very good and important question for all of us. I can bring many reasons, but of course, first reason is stigma, discrimination, and disparities. Tuberculosis is well known as disease of poverty, the disease of the most marginalized people. And we, WHO, we are staying very strong for their needs. We are advocating, and we are doing our best to make essential health services accessible and available for them. Health is not a privilege; it is a right, and everyone should have this right. And now we can see how people with the COVID, due to different restrictions and limitation, are also facing stigma, and we can understand better the situation for people with the TB for many years, and to combat stigma and discrimination, and to prioritize their needs. That is our aim, and we will continue advocating, and we are staying committed to their needs. But much more should be done, and unfortunately now the situation is even worse. And if we will not urgently address their needs, it may go out of the control.
Thank you. And you mentioned disparity of access to TB services and care. For one of our viewers on Facebook, Tripurana Vijay Gopal Rao, asking, how does WHO help poor countries to fight against TB?
Again, very good question. And the World Health Organization, as organization leading and driving global health agenda, of course, one of our priorities, and our Director General many times stressed on it, is support countries move towards universal health coverage. And we are not only advocating, but we are also giving directions, guidance, and developing policies based on the latest findings from the research, from the science, and from different studies. And I can bring just one example how our policies and technical guidelines can support countries, can support individuals with the disease. It's well known that there are several forms of tuberculosis, and one of the most dangerous and difficult is tuberculosis with drug resistance, especially when it's multi-drug resistance or extensively drug resistant tuberculosis. And patients with these forms, even 2-3 years ago, they had to go through very difficult and long-lasting treatment. Sometimes the duration was up to 2 years with many drugs, with the painful injectables, with the numerous side effects. Now, due to our recommendations, these treatments can be shortened 2-3 times. It will take now 9-12 months, and it's significant improvement. And furthermore, we are recommending now fully oral treatment. And in the situation of the pandemic like now, this treatment, fully oral treatment, can be provided at home. It will be easier, faster, and furthermore more effective with less side effects. And with the rapid uptake of these guidelines, we can make access for the better treatment options easier and faster to the people suffering, and first of all to the poorest. That's why our role is advocate, is promote and further develop best treatment options, faster diagnostic options, and also, as I told, TB preventive treatment is also life-saving, and in the situation of the COVID pandemic can prevent of development of other severe diseases, TB, affecting lungs.
Thank you. And also, as we know that it has already been a year that we live in a pandemic, and COVID-19 has put a strain on health progress in so many levels and spectrums. I just wanted to ask you, is there any challenge that WHO face in terms of progress that we have made towards ending tuberculosis?
Unfortunately, yes, we have numerous challenges, and of course, TB programs and patients with TB are not unique. Health systems are facing numerous challenges, and we can see disruption of the essential services, and in our case, these are services for people with the TB. And as I told, we can see in most of the countries sharp drops in the TB notification, in TB diagnostics. And as I told, it means that people are not receiving life-saving treatment, that they're continuing transmitting disease, especially in high burden setting, in crowded settings, among household contacts and people with other social conditions. So these tendencies are very, very concerning and risky. So that's why we should not only use not only World TB Day, but we're actively promoting this knowledge. And I hope with your support as well that TB is still big threat, and all lives matter. We cannot neglect and needs of the people in many countries, and as I told, TB is everywhere. Of course, we have 30 highest TB burden countries, but after social economic outbreaks and crises, we know from the history there could be also outbreaks of TB in many countries. It should be known and understandable, and we can and must take urgent measures.
All right, thank you very much. So let's take a couple more questions here. So there's a question from a viewer on Facebook, Sudhir Mishra. He or she asked, do we have any specific intervention for child tuberculosis and COVID together, uh, especially in the developing countries?
Yes, we have challenges, but we also have opportunities. And the opportunities are given by some similarities in the disease symptoms. And we can see coughing, fever, weaknesses, loss of weight in both patients. Of course, there are differences. And first of all, because diseases are caused by different agents, virus and mycobacteria in case of tuberculosis. And the development, despite of some similarity, is different. TB is developing slower. And of course, all the differences are well known to the health workers, community health workers, but people also should be aware about them. But the same platforms, for example, lab platforms for the rapid diagnostic, molecular diagnostic of TB could be used for the COVID testing as well. And that's why we are urging for dual testing, both for TB and COVID. And you can not only timely diagnose, but provide timely treatment and successful treatment. So that is important. We know that most of the patients with TB can be successfully treated. And for most of them, without drug resistant, it could be just 6 months treatment, even shorter treatment with fewer drugs. So that's why we cannot and should not lose this option and opportunity.
All right, thank you. So I just wanted to say that I'm impressed with the high interest of we were on the Global Tuberculosis Program at WHO. So we've got this question from Ketahan Mola from Facebook, watching on Facebook, asking how does the WHO tuberculosis program work to reach the most marginalized poor people like migrants or refugees or those who work in farming areas who are highly affected by the TB disease?
I see that our audience is aware very well about the most vulnerable groups, and awareness is what is needed. And so it's very important resource, awareness, and we are trying to address these needs. First of all, we are spreading this information, disseminating this information about the vulnerabilities, about tools, the latest tools we have, and the guidelines, how they could be used. The latest release, for example, were guidelines on TB screening, and these guidelines recommend how we can relatively easy and in all the settings screen the symptoms, how we can provide chest radiography, even in the absence of the qualified health workers. We can use digital tools, modern tools, and we can use rapid diagnostic for the rapid testing and diagnosis, not only disease but also screening for TB. And once we've identified, we can immediately provide either treatment for active disease or for the TB infection. And of course, migrants, refugees, homeless people are among those who should be reached first. So through knowledge sharing, through the guidelines, clear guidelines, through advocacy, and through direct support to the countries, we are trying to make these approaches and these tools available as soon as possible.
Thank you very much. And you talked about new guidelines on TB systematic screening. And actually, there's a number of healthcare workers following us on WHO social media platforms and perhaps watching us right now. Could you please tell us what role healthcare workers can play to help us end tuberculosis?
First of all, I would like to acknowledge and to applaud to our health workers, to the community health workers and civil society who are now at the first front of the fight, not only against TB, but also against COVID. and their role is vital. They're first who who are addressing the needs, and that's why if you will be in contact with us and will be aware about the latest recommendations and tool, these opportunities will become much more effective and better. Of course, we have many limitations in TB because of chronic underfunded, not only TB programs, but also research in TB. But for the last several years, we've received new, more effective drugs, new rapid diagnostics, and we have even in the pipeline some vaccines. We've received information about the effective completion of phase 2B trials, and of course we're expecting more progress and more investments in these developments. And if health workers will be following our latest recommendations, treatment outcomes, access to timely diagnosis and treatment will become much better and more effective. So that's why I would encourage you to follow us, to stay closely with us, and jointly we are much more stronger, because knowledge and even excellent guidelines without rapid uptake, they will be useless.
Yes, exactly. I totally agree that together we can work and we can end TB together. And you did explain earlier about the theme of this year's World Tuberculosis Day. The clock is ticking, and we are calling on all countries to act now. And we have one question from LinkedIn, Simian Meskelo Laloto. This viewer asking, what will be short or long-term goals of WHO to end TB? So perhaps you could explain what progress we have made so far in the past years and what is needed now to end tuberculosis.
So, question is very important. Now we have NTB strategy and its targets, and our targets of NTB strategy are fully aligned with the Sustainable Development Goals and with targets from the political declaration of the high-level meeting on TB, which happened in 2018. So our big aim and target is to end TB by 2030. But in 2020, we had our milestones, and these milestones were to reduce TB incidence by 20% in compare with the 2015, reduce TB death by at least 35% in compare with the same 2015. And another important target was related to the financial hardships, zero catastrophic costs for TB patients and for their families, what is another very important target. Unfortunately, even before pandemic, the world was not on track, and we managed to reduce globally incidence by 9% and mortality by 14%. In terms of reaching political declaration targets, and there are 40 million people should be provided by treatment for 5 years until 2022, and 30 million should be provided by preventive treatment. We've made progress and managed to provide 14.1 million and by treatment of active disease, and also 6.3 million of those eligible by preventive treatment out of 30 million. Progress was achieved by joint efforts, but much more should be done. And now, as I told, we have huge risks that we will be pushed back to the level of 2010 and 2012 in terms of TB-related death and TB incidence if urgent measures will not be undertaken and the continuation of essential TB services will not be provided. So we can save, and we've seen that 63 million lives were saved for the last 20 years, but you can imagine with losing 4,000 days lives per day, how many lives were lost. and we should stop this tendency. And as I told, even in the midst of the COVID-19 pandemic, it should not be used as an excuse for people. They cannot wait. People with TB, it's severe disease, and or we should do our best jointly to provide access to the treatment.
All right, thank you very much, Dr. Kasiba, and I'm glad that we have seen some great progress, and despite what we're going through during COVID-19. All right, we've got some last questions here. We're going to take a couple more questions before we end our conversation today. So one is from Facebook. One viewer is asking, can you get tuberculosis twice?
Unfortunately, yes. We can see the evidence, and it may happen. And we know a lot about TB, but we are somehow not using this knowledge. Still, significant gaps in the awareness about TB, in addition to stigma and discrimination. They don't allow us to move fast towards our target to end TB. Yes, it can happen, and frequently it happens when people have social determinants I've mentioned before, plus comorbidities, and they belong to the vulnerable groups facing socioeconomic hardships. And another important issue which should be known: if a person didn't complete treatment, he is of course under the risk that disease will come back, and may come back with more severe form of the drug-resistant tuberculosis, where the treatment outcomes could be much worse. And if when we are treating a patient with so-called susceptible TB, we can almost in 85% of the cases be sure about the successful treatment. For people with a drug-resistant TB, the treatment success is much lower, up to 57%. So this is global data. But as I told, everything is in our hands. If we have knowledge, and if we know how, if we know about symptoms, if we know how to diagnose, and importantly, if we have access to these services, it could be completely treated and will not come back again. So that's why let's try to use this knowledge not only for our own benefits, but to protect people with whom we are living and working, and even unknown people. You can join our initiatives, and different initiative. And for the young people, for example, we have 1+1 WHO initiative, and thousands of people are already joining.
Lovely. And before closing our conversation today, do you have any last word to share with our viewers today?
First of all, I would like to say once again, many thanks for your attention, for your interest, and I can see a lot of questions. Unfortunately, due to the time limit, we cannot respond all the questions, but you can share with us. We will try to respond offline, and you can find more information on our website, and the links could be provided. Also, follow our news flashes, latest releases, and please try to disseminate this knowledge, to use this to protect yourself, your families, and only by joint efforts we can combat this so-called old disease, preventable, treatable disease, and avoid outbreaks and another decades of a very difficult fight against tuberculosis. All lives matter. Let's be joined, let's be responsive, and let's support each other.
Well, thank you very much, Dr. Kaseva. And I've seen a lot of questions asking about the data and statistic on tuberculosis. So we're gonna put up a link down below on WHO website where you can find all the data and all the information on World Tuberculosis Day 2021. And I'm seeing that we are running out of time now.
I'm sorry, one small addition. In terms of data, we are digitalized. You can download for free our global TB report, and you can find all the interested information about the countries. You can compare trends. You can see global tendencies. I would recommend you to use this digital tool.
Yes, I think the application is available both on App Store and Google Play, and also
languages.
Yes, right. I would like to repeat this one last time, that tuberculosis is preventable, treatable, and curable, and together we can end tuberculosis once and for all. Thank you very much, Dr. Kaseva, for taking the time to talk to us today.
So thank you very much, and stay safe and healthy.
Thank you. And it was a very interesting discussion. And today we had a great audience watching us from all over the world. I'm going to list out some of the countries. So we have people watching us from the UK, Indonesia, Bangladesh, Thailand, Pakistan, Benin, Cameroon, Nigeria, Cambodia, Switzerland, South Africa, Malaysia, USA, Afghanistan, Nepal, Vietnam, France, Italy, Germany, Canada, Egypt, Sri Lanka, Congo, Nigeria, and many others. So thank you for watching and sending in your questions. I hope you've learned some useful information from our expert, Dr. Kaseva, and please stay tuned on our social media platforms for upcoming activities and useful information and educational resources for tuberculosis and also for other public health topics. Thank you again and see you next time.
Thank you very much.